Hi, everyone. My name is Dr. Samantha, and I'm the maternity mentor. Welcome back to another one of our live Q&A sessions that we have here every Monday at 9 p.m. Eastern Standard Time. This is a chance for us to get to interact with you guys by answering some of your questions live that you put into the chat, as well as answer any questions or comments that you may have submitted on our videos this week. Please remember to hit the like and subscribe button to the channel and hit that notification bell to get the latest notifications on content that we have coming out. We really appreciate all of your support. We are also on Facebook, Instagram, and Twitter for additional content, so you can see those, and we will link those into the description. And remember, share the channel with your friends and family. We look very much forward to talking with you guys. So if you have any questions, please feel free to put them into the chat. I'm going to go ahead and get started. We have lots of great questions this week. So I'm going to start off this week with some antibiotic questions. We get questions about antibiotics all the time, and they're really great. So our first question comes from a pregnant mom who says, I'm 5 weeks pregnant with a small UTI. Is cephalexin safe? So urinary tract infection is also known as a UTI. This is one of the most common causes of bacterial infection during pregnancy. Antibiotics are only used for bacterial infections. They cannot help treat a viral infection. Bacterial infections are very serious during pregnancy. Pregnant moms are considered immunocompromised, so you're not going to be able to fight off infections the way other people can. Additionally, urinary tract infections, despite what you may have heard, once they're established, they do not really respond to natural interventions, and they usually do require antibiotics. So antibiotics are a pill that kills bacteria. And there are several antibiotics to choose from. Most antibiotics are safe, but there are a few that we need to be careful of. Once you're given an antibiotic and you choose to take that antibiotic, it's very important that you take all of the antibiotic. Don't just take a few pills. And this is very tempting because pregnant moms are often worried about taking medication because they think it might harm the baby. Additionally, the unique thing about an antibiotic is after 1 or 2 days of taking it, you feel so much better. And because you feel better, you feel like the infection is gone, and therefore you stop the medication. But the infection is not gone. Just because you feel better doesn't mean the bacteria is all gone. In fact, there's usually bacteria still left. And that bacteria actually will get stronger if you stop the medication. Because what happens is they figure out what medicine we're using to fight them, and they build defenses against that. And then they start reproducing, and the next thing you know, a week later, you are sick again with a stronger infection that requires a stronger medication. Why do we have to treat these infections? Because if left untreated, bacterial infections can cause sepsis, which is a life-threatening condition for mom, and they can lead to preterm birth, stillbirth, and miscarriage. So it's very important. Now back to this mom's question. She's asking, is cephalexin, which is an antibiotic, safe for use during pregnancy? And the answer is yes. Cephalexin is one of the medications that we use commonly during pregnancy. It's been used for a long time, and it's been shown safe to be used even during the first trimester. So this was a great question to ask, and it is a very, very safe medication for us to use. Now, the next thing we're going to talk about is actually bleeding during pregnancy, because we have a lot of moms who ask about bleeding, and bleeding is a very scary thing during pregnancy. So the thing is that we hear about bleeding and we're always like, oh my God, bleeding, it shouldn't happen. But there's actually a lot of reasons why bleeding happens during pregnancy. That's very normal. So our first question about bleeding is a question that says, if I've been pregnant for 5 weeks and I'm having brown discharge, is this normal? So this starts with the question of brown. So let's talk about the colors of bleeding. So we have brown, which is old blood. This means there was a bleed somewhere and that bleeding has stopped or is resolving. Then we have dark red, which is usually the sign that an active bleed is going to a non-active bleed. Then we have bright red. This is usually a sign of active bleeding. This is the one that's most concerning depending on what's going on. And then we have pink. Pink is usually like a very mild bleed that is happening, and it's mixed with discharge, which gives it that kind of pink color. Now, there's also the amount of blood. If you have little tiny spots of blood, that's not nearly as concerning to us as like big gushes of blood or filling up a whole pad or something like that. So the amount is also important. Now, anytime you see anything that you suspect is bleeding, you need to contact your healthcare provider. I'm about to tell you some of the reasons why bleeding can happen, and it's normal. But that doesn't mean you assume that it's normal. You want to always get checked out, because you could have bleeding for one reason at one time in your pregnancy and start bleeding for a completely different reason during a different part. And you may bleed multiple times for multiple different reasons, which is why you always get it checked out. So starting early in your pregnancy, for one, you can actually continue to have a period. So a lot of people don't realize this, but you can actually continue to have your normal menstrual cycle for even a couple months and be pregnant and have a safe and healthy pregnancy. Sometimes your body just needs to kick into gear and it doesn't really realize or correlate that you are pregnant, and so therefore you might have that menstrual cycle. The next reason is implantation bleeding. So our egg gets fertilized with sperm up into the fallopian tubes. So you have a uterus and a cervix at the bottom, and then at the top of the uterus are two fallopian tubes. And the egg gets fertilized up here, and then it has to travel down into that uterus and attach to the uterine wall. So when it attaches to the uterine wall, that's called implantation. And oftentimes women will spot during that time. Now, if you read the books, there is kind of like this set type of schedule as to when that all occurs, but everybody's different. Everybody's body is different. And therefore, you don't always know exactly when implantation happens. So that's why you might see implantation bleeding when you're not expecting it. Next, sex is a very common cause. So what happens with sex is that the hormones that allow you to maintain a healthy pregnancy, those hormones thin out the vaginal tissue and make everything kind of dry. So if you have sex without proper lubrication, it can cause little tears, which can actually result in spotting that you will see. You may also get a subchorionic hemorrhage. We have a video about that, so I'm going to link that into the description, and I'm not going to talk too much about it, but that's basically a pooling of blood underneath the placenta. You may also have what's called a placenta previa. This is where the placenta forms over the cervix, and if the cervix opens at all a little bit, you may have some bleeding. So these are just some of the causes of bleeding. So in the case of this person who is seeing brown discharge, you need to contact your healthcare provider so that they can go ahead and they can assess you. Now, another question we got is that she says, at 9 weeks, 6 days, I'm 10 weeks today, I saw white discharge in my underwear, but when I wiped it out, it looked very pale pink. Today, this happened twice yesterday, not at all today. I've gotten back cramps for this entire pregnancy, but now I'm very scared. I have an appointment in 2 days. I'm hoping everything will be okay. So this gives us a good segue to discharge. So there are normal types of discharge that you might have in your pregnancy. The most common is basically a clear discharge. After that, there's other colors you may see, but you kind of want to get them checked out, especially if you're having any kind of symptoms. These colors include, besides the colors of blood, they include green and yellow, gray, and white. So green, yellow, and gray are usually signs of a couple different sexually transmitted diseases, as well as one type of bacterial infection. These are not good colors, and you definitely want to go and get them checked out. What they would do for any type of discharge that they're checking out is they're going to take a sterile swab. So it's like a long Q-tip, but it's sterile. And they have you lay back, and we put in a speculum, which is the metal or plastic kind of clamp that opens up so we can look and see the cervix, okay? It's a little uncomfortable when we do this, but it's important for us to see where that discharge is. Then we take that sterile swab and we get a little bit of that discharge and we send it off to a lab. And the lab can tell us what we're dealing with. It can tell us whether this is normal discharge, whether it's urine, whether it's semen, whether it's a bacterial infection. a yeast infection, a viral infection. So we can check all of that to then determine what's going on and what the plan of care is. Now, white discharge. White discharge is often associated with a yeast infection. So white discharges, it's like oftentimes it's chunky and it will be associated with itching. Yeast is not normal during pregnancy. It is a common infection that we get during pregnancy, and we need to get it treated, because if left untreated, it can cause the same issues as like a urinary tract infection, miscarriage, stillbirth, and preterm birth. So what we do with that is we go ahead and we give you an antifungal medication. Now, in this case, she mentions pink discharge. Yeast infections are highly irritating to the vaginal skin, and the vagina will get extremely raw and red. And therefore, even just a little bit of wiping after the bathroom can cause some pink discharge. So that could be what's going on here, is that there is a little bit of bleeding, but it's not necessarily because you're bleeding from somewhere else, but because you have a yeast infection. So you definitely want to get that checked out. I'm going to go ahead. I have another question about bleeding, but I'm going to stop because I see, and I'm hoping I say it right, Michelle's question. And I saw your question come up on the comments. So I want to encourage anyone who's listening. We do see the comments on the videos, and I love that you're asking it in the chat, because I definitely want to get to your question if you're here. So Michelle, what about prothidin 50 milligrams daily during pregnancy? My consulting doctor told me it is safe. Please reply. So thank you so much for asking. I really appreciate it. So we do not use this medication here in the US, okay? This is not a medication that is something that we would even prescribe when you're not pregnant. However, one of the things that I have is specialized training in medicating women who are pregnant or breastfeeding. And part of the way we do that is we get specialized training in medications, but we also utilize other resources. So I utilize a resource from a guy named Thomas Hale. He's a pharmacist who aggregates data from animal studies and looks at the molecule size and the chemistry of these medications to determine their safety. To answer your question specifically, no, this is not a safe medication. In the US, it would be prohibited for use with a pregnant woman. It has been positively, that means it has definitely been shown to cause birth defects during pregnancy. So I would never prescribe this to a pregnant patient, and I would not recommend it. Now, there are other medications that you might be able to take. So what you want to do is you want to go back to your healthcare provider and figure out what are options for you. If you are currently taking this medication and you've been taking it for more than a couple days, you cannot stop this cold turkey. However, you need to call your doctor tomorrow and figure out what the plan is, especially if you're early in your pregnancy. A lot of medications you cannot just stop because there's risks to use. So you need to get tapered off, but you should be able to get tapered off very, very quickly, like within a couple days. And then you want to figure out what your alternative is going to be. Now, what I just said is kind of scary. So let me also tell you this, Michelle. Just because you take a medication that has been shown to cause birth defects does not mean it guarantees birth defects. So I would not recommend this. You need to get off of it. But just because that's happened doesn't mean that your baby has birth defects right now. They need to monitor your pregnancy, and you definitely want to get some ultrasounds to see how the baby looks. But your baby could be totally fine even if you have taken this medication. If you have not started this medication, find out right away what other medications you can take. But this is absolutely a no, and I'm really glad you asked. And before I get to your question, Z, I see your question. I want to tell you that if you guys are ever prescribed a medication and you're really worried, the other resource that you have besides your doctor is your pharmacist. So local pharmacists should have specialized training like myself in medications, because their job is to give you medications, and they're supposed to check for the safety of things. So if you're not sure, you can go to your local pharmacist and also ask them about safety of a medication. Okay. So thank you for asking that, Michelle. So Z, Please, how safe is metoprolol in early pregnancy? I was on losartan for just 2 weeks and my doctor switched me to metoprolol. Just yesterday, I had some cramps and a little bleeding. So one of the things I'm going to do is I'm going to look that medication up in the same guide I was just mentioning. I can tell you for sure that metoprolol is used later on in pregnancy for sure with no problem. I believe it is also safe for early pregnancy, but I want to double check. Yep, it is. It is safe. It is what we consider to be safe during pregnancy. So metoprolol is a beta blocker. That's a blood pressure medication. So it helps lower blood pressure. And in this case, metoprolol also helps lower heart rate. So there's for a variety of reasons, there's certain heart conditions that we need to lower your heart rate, and this is one of them. Metoprolol also happens to be okay for use for anxiety too. It can help a little bit with anxiety. So it's kind of a little bit of a bonus. Now, you bled yesterday. So you're 4 weeks pregnant, and I was actually talking a little bit about bleeding just a few minutes ago. It's possible that the bleeding has nothing to do with the metoprolol at all or the switch from losartan, and simply it has to do with other types of normal bleeding, such as implantation bleeding, such as possibly getting the last remnants of a period, possibly sex. It could be a variety of things. Now, the other thing is, so you have high blood pressure. So high blood pressure also comes with a couple unique things. One of the things that can happen with spikes in blood pressure is you can actually break little blood vessels everywhere in your body. And that sounds scary, but it's usually little tiny capillaries. Well, if you broke a couple capillaries, say in the vaginal area, that it's possible that you saw some spotting. However, what you need to do is you need to tell your healthcare provider immediately. Okay, you need to call them and you need to get assessed because they really probably need to do an ultrasound to determine what is going on. And for example, it could be a subchorionic hemorrhage, which we'll link that into the description, and other things that just need to be monitored. They should also be sending you to a high risk doctor, a maternal fetal medicine doctor. These are the doctors that take care of high risk pregnancies. If you have high blood pressure, your pregnancy is considered high risk. So you really want to be sent to that doctor. However, they oftentimes won't see you until you're 12 weeks pregnant because there is high risks of miscarriage for any woman prior to 12 weeks. So you're definitely going to want to get that checked out. The other thing I'm going to tell you is that you want to make sure that they get your blood pressure stabilized as soon as possible. So make sure you're monitoring your own blood pressure and writing it down for your doctor so you can keep track and tell them if there's any kind of different patterns to your blood pressure. Sometimes we medicate women once a day, twice a day, even 3 times a day. And it really depends on if we see blood pressure spikes. And when your blood pressure is spiking and then going low, that's actually not stable blood pressure. And that also has risk for the pregnancy. So that's a good question. But metoprolol is safe. So that's a good medication. And definitely go get that checked out. I'm going to answer another question that we had about bleeding since we've kind of been talking about bleeding. I had a patient ask, I was pregnant last year with a partial molar pregnancy, light bleeding without cramping from 6th week to 8th week when the sac collapsed, had a heartbeat and all until then. And I went through a D&C. The HCG dropped back below 5 in 3 months. Now I'm pregnant the second time, experienced a gush of bleeding with a clot at 6 weeks during a heavy workout. Went for a checkup, sac and baby are still there with a heartbeat. Diagnosed with a threatened miscarriage. It's been 1 week and there's continuously 10 drops of blood throughout the day. It used to be brown but has turned pink/red. No cramp, no fever, all other signs for miscarriage. How frequently should I be going to the OBGYN for checkups? Should I stay on bed rest or some household work or office work is fine? So this is a great question. You're welcome, Z. I'm glad to hear that it's well controlled. Just get that bleeding, that blood checked out. It's probably just normal, but you still want to have them look at it. So when you have a threatened miscarriage. This means that they believe the signs are there that you're going to, pass your baby. So it's very challenging for women to be told this and then to go home and try to figure out what's going on. And in this case, she had a gush with a clot. And just to be very as sensitive as I can be, if you are early on and you are bleeding and they're telling you you have a threatened miscarriage and you bleed and you pass a clot, which looks like kind of like a little piece of blood, like a little kind of soft cotton ball-y type of piece of blood, that could be your baby that you've passed. And that's very sad, but it's also hard for you to tell. People don't know, is this what happened? Is this not what happened? And then they're left saying, well, what do I do now? If you were to take a home pregnancy test right after going to the bathroom with a gush of blood and a little clot, and you did have a miscarriage at that moment, you would still test positive for being pregnant. That's because of that HCG level that she mentioned. So HCG is human chorionic gonadotropin. This is the hormone that lets us know you're pregnant. In a healthy, successful pregnancy, if we take your blood and we see this hormone and we take it again a couple days later, the hormone levels should be going up. That's what should happen during a healthy pregnancy. So what can you do if you have a threatened miscarriage? One of the things you can ask for is the blood test for an HCG level. So they're going to get your baseline. And then you ask to go back a couple days later and have another HCG level taken. If you are having a threatened miscarriage or have had a miscarriage, your HCG level will start to drop. So whereas with a P test, which tests for HCG as well, all that's going to show you is that it's positive. It can't tell you the level. A blood test can show if it's trending down, which means you are miscarrying the baby. As far as rest, so she mentions that she was having a heavy workout and then she had this. So it is possible that the heavy workout caused it, but it's not necessarily the case. It could have happened for a completely different reason. We now know that miscarriage is extremely common, and there's lots of miscarriages that happen before women ever even know that they're pregnant. So your body is going to try to eliminate a pregnancy with a embryo that is not compatible with life. If that embryo has genetic abnormalities that wouldn't allow that embryo to develop into a baby that could live outside of the womb, your body is going to try to eliminate that pregnancy, because pregnancies are stressful and dangerous for moms' bodies. We go through a lot to be pregnant. And so that's why a lot of these happen before we ever realize. But in today's modern society, it's very easy to take tests well before we used to, even find out. So it's possible that something else happened. Now, as far as bed rest, if your doctor told you to be on bed rest, you need to be on bed rest. You should be able to walk around to go to the bathroom, but bed rest is bed rest. You need to ask for guidance. As far as being able to work and stuff, I wouldn't be doing any heavy lifting or any heavy exercise or anything like that, just in case. I also wouldn't be having sex. Sex is usually not contraindicated during pregnancy, but if you are having a threatened miscarriage, you don't want to be having sex right now. However, you should be able to do something like an office job, and resting on your couch should probably be fine. But ultimately, I would be asking in your case to go ahead and ask for the HCG levels. I wouldn't necessarily ask to be checked up by the OBGYN because there's probably not much they can do. Even if you are pregnant, the most they're going to do is another ultrasound to see how the baby is doing. Okay, so that's what I would do there. For those of you who are joining us, I'm Dr. Samantha, the maternity mentor. I'm here for another one of our live Q&As. Please feel free to put questions in the chat like some people have already done, and we'll answer those live. I'm going to go ahead and I'm going to go on to the next set of questions, which is actually some questions about the use of medication for depression and anxiety during pregnancy. So we had one mom who put in basically like a list of medications, and they were in another language, so I had to translate some of them. So I'm going to say the name that was put in, what I believe is the English version, and then I'm going to let you guys know what is going on based off of the English version. So the first medication was Daxid 100 milligrams. So in English, the English equivalent would be sertraline or Zoloft. So I will tell you that sertraline and Zoloft is safe for use during pregnancy. It's actually one of the most common SSRIs which are used. So SSRI, serotonin selective reuptake inhibitor. Basically, it means it boosts serotonin. What is serotonin? It is a chemical in your brain that helps to regulate your mood. SSRIs are used for anxiety and depression usually. And sertraline or Zoloft, which is what I believe Daxid is indicated for depression, anxiety, panic disorder, and even a little bit of obsessive compulsive disorder. It's a fantastic medication. It is probably the number one medication used with pregnant women and women who are breastfeeding, probably because it's been used the most. Simply that. There are plenty of other medications and other SSRIs that are also safe during pregnancy, but this just happens to be the most common one. This is extremely effective for use. The next medication was Uvox 100 milligrams. So I looked this up, and I believe the English translation is Luvox or fluvoxamine. So Luvox or fluvoxamine is another SSRI. This one is commonly used for OCD or obsessive compulsive disorder, which is part of the anxiety family. So it's really good with anxiety. It does do depression, but not as good. So Luvox or fluvoxamine is one of these medications that we have to evaluate risk versus benefit. So we can't test medications on pregnant women or women who are breastfeeding because it's not ethical. So we have to gather all this data. So for Luvox, there have been some animal studies that have shown some birth defects in the animals, specifically eye defects and defects of the reproductive organs. Additionally, there is a lot of evidence that Luvox is associated with a withdrawal syndrome that all SSRIs can cause, but a withdrawal syndrome in the baby that's a little bit more significant or robust than some of the other ones. So Luvox is one that it's a risk versus benefit, and I'll get back to that in a second. The next medication was Busprin, 10 milligrams. I believe that she is referring to Buspar or Buspirone. Buspirone is an SSRI that we use to treat pretty much just anxiety. It can be taken up to 3 times a day. It's pretty good at anxiety, which is really nice because it's not a controlled substance. It's not a risk for addiction for the mom, and it's safe for baby. So this one is safe for use during pregnancy, and it can be very effective add-on for anxiety. So that one's really good. And the final one was in Asprito, 2 milligrams. In English, I believe she's referring to Abilify or aripiprazole. So Abilify is an antipsychotic. That sounds super scary. It's not as scary as you think. So the antipsychotics traditionally were used for schizophrenia and bipolar disease, but we've now started to use them for a variety of other things, including major depressive disorder, anxiety, and insomnia. You know, it depends on the medication and what it's indicated for, but this group of medications is actually very exciting to use, and there's a lot of good benefits. Now, Abilify itself is another risk versus benefits medication. There's not a lot of data out there to say whether there's issues with the baby. So it's one of those things that you kind of want to gauge what's going on. Now, risk versus benefits. What do I mean by this? Untreated anxiety, depression can lead to a whole bunch of complications for the pregnancy and a whole bunch of issues for the baby. Untreated anxiety and depression releases stress hormones in the body, and these stress hormones will attack the mom's entire system. It also attacks the placenta. So as a result, babies are often smaller and their placenta doesn't work as well. It can lead to miscarriage. It can lead to preterm birth. It can lead to stillbirth. Then untreated mood disorders can also lead to other issues with the baby. And it can, of course, lead to mom having postpartum mood issues, including postpartum depression, psychosis, and postpartum anxiety. So it is extremely important for us to treat these mood disorders and treat them effectively. There's no point in giving a mom a medication to get her to 60% better. You want to get her to 100% better if possible, because since we're using the medication, we need to use it to its full value. So with the Abilify and the Luvox, If there's not another medication with a safer profile, you would consider these, especially Abilify. Abilify can control psychosis. Psychosis is where your mood is starting to become so unstable that you'll have hallucinations and delusions and you'll be paranoid. This is extremely serious for both mom and baby. So if a little touch of Abilify helps with that, we would rather give that than not give anything at all and have mom decompensate and end up in a hospital. So definitely for all of these medications, you want to check with your provider, but there's several of these here that are really good. The other thing is, if you decide that you don't want to take any of these medications, you cannot just stop them. As I said, for example, with Abilify, if it's controlling psychosis and you just stop it, you could have a psychotic break and end up in a hospital. So if you decide that you don't want to take these medications, you need to work with somebody like me, who's a reproductive psychiatrist, well, a psychiatric nurse practitioner, I apologize, who goes ahead and helps taper you off so that you come off the medication safely. That was a great question. You're so welcome, Michelle. So for those of you who are joining us, hi, I'm Dr. Samantha. I'm the maternity mentor. We're here for another one of our live Q&A sessions that we have every Monday at 9 p.m. Eastern Standard Time. Please feel free to put any of your questions into the chat and we will get to them. And we're going to keep answering some of the questions that came to us on our videos. So we had that question, and we had another question on UTIs. This was another medication question. I love the medication questions because I think they're very important. So I was diagnosed with a urinary tract infection. My gynecologist recommended nalixic acid, 500 milligrams for 5 days at 11 weeks. Is this safe for my baby? Thanks. So again, this is a medication that we do not use here in the United States. So I cannot speak to this medication specifically. It is in the family of antibiotics called fluoroquinolones. So this group of medications, which includes a medication we use here called Levaquin, is not one we traditionally tend to use during pregnancy unless we really have to. These medications have been shown in animal studies to have some risk for some birth effects. So if you can avoid this medication and being in this same class of medications, I would ask if there's any other antibiotic that you can use for your urinary tract infection. There's a lot of antibiotics out there that are really effective. Now, let's say you've had a urinary tract infection that is treatment resistant. You have been using multiple antibiotics and none of them are working, and you keep getting sick, and you're at risk for going into the hospital for, say, IV antibiotics. Then this might be the right medication for you. So what do you do if you're kind of left with this choice? You need to have your doctor give you all the risks versus benefits. This is how you make an informed decision. Okay? It is very important for you to get all the information, because you may decide that it's worth the risk to treat the infection. Now, how do you determine which risk, whatever? You need to ask the right questions. So one of the things I've told you guys, there is a risk if you have a urinary tract infection that you could have a miscarriage. Okay? Well, there's a lot of different factors that go into that statement. You're definitely going to be more likely to have a miscarriage if you're 4 weeks along and your infection is out of control versus if you're 24 weeks along. And so, among other things, if you're 24 weeks pregnant, you could potentially deliver the baby. It would be a preterm baby, and there could be serious risks to the baby, but the baby has a chance to survive outside of your belly. So those two scenarios provide different sets of risks and benefits. And that's why when you're looking at medication, you want to also ask those questions so that you can make an informed choice. All right. So we have a question about dilation. I am 36 weeks pregnant and I am 3.8 centimeters dilated. What can I do to help this process? This was a fantastic question. I love this question. What can I do to help this process? Absolutely nothing. In fact, do not do anything. You should not do anything. So for those of you who are wondering, she's 36 weeks pregnant and she's already almost 4 centimeters dilated. Why can't she do anything? Because this is a preterm baby. So contrary to popular belief, once you get to 36 weeks, you are not full term and ready to go. Once you get to the 9th month, that doesn't mean it's over. In fact, the research now shows that babies continue brain development up to 39 weeks of pregnancy. And that brain development is essential for feeding. It's also essential for temperature regulation and glucose control. So if that baby comes out early, that baby may have feeding problems that requires the baby to go to the NICU, the neonatal intensive care unit. That could prevent the baby from going home with you. The other thing that can happen is the babies over those last couple weeks get fat and chunky in your belly. Now, a lot of people get scared about this because they're worried that they're not going to be able to vaginal birth. But, when I say fat and chunky, I'm talking about 5 pounds to 7 pounds. And those 2 extra pounds, a lot of that is fat storage. That fat storage will help your baby to maintain their glucose level and maintain their temperature. Those are 2 very important things to have a healthy, stable baby. So it is essential that we do not deliver you until 39 weeks pregnant if we can help it. In fact, it used to be that there was a lot of different health conditions that we would deliver a mom early. For example, in Z's case, she has high blood pressure. Back in the day, a 36-week pregnant mom who had high blood pressure might be delivered early because of the risks to mom to develop preeclampsia. Now that is not the case. You can have high blood pressure and we will wait until 39 or 40 weeks to deliver you as long as your blood pressure is under control and you and the baby are doing fine, because we now know it's better for baby to stay in for as long as possible. So now this mom is 36 weeks pregnant and she is 3.8 centimeters dilated. That means she's almost 4 centimeters dilated and you only have to go to 10 centimeters. I wouldn't do anything. Braxton Hicks contractions are probably dilating and softening that cervix all the time. And so in this case, you do absolutely nothing. For those of you who are 39 weeks pregnant or above, we do have some videos on how to help your labor along naturally. So we're going to link those into the description and you can check those out. All right. Heartburn, which is extremely common. I am 33 weeks pregnant and I have very bad heartburn. Is this normal? Yes, it is very normal. Now we have a video on heartburn. So if you want to check out some homeopathic remedies and some different things that you need to know about this, please check out our video. We'll link the heartburn video into the description. But why is heartburn common? So as you get more pregnant, you get this big old baby inside your belly. And one of the things that happens with these babies is they shift all your organs around. So everything is moving out of the way. Well, just like the baby can press on your bladder and that can help you, or that can cause you to end up getting a urinary tract infection because you can't empty your bladder well, the baby can also push up onto the stomach. And what ends up happening is when you eat a lot of food, you end up, that stomach acid ends up refluxing up into your chest and your throat and you get heartburn. So unfortunately, there's not usually a lot you can do. I do want you to check out the video because there are some products that you can use if your OBGYN says that it's okay. They can help alleviate some of that heartburn. There are also some times where we need to check you out. For example, if you have an H. pylori infection, this is a bacteria that can be in the stomach and cause heartburn. That's super easy. It's a super easy test, and it's just either a stool test or they do this little balloon test where you blow into a balloon and then they can test that. If you have one of those, if you have that, the treatment is a special kind of heartburn medication and an antibiotic, which is safe for pregnancy. And then as a result, you will actually get complete relief from your heartburn, hopefully. So it is really normal. Unfortunately, it is very, very annoying, but it will go away once you have the baby usually. So we have a thyroid question. I'm 5 weeks, 3 days pregnant, and I just had my TSH lab come back today at 2.99. My IVF doctor wants to start me on Synthroid. Historically, I have not had hypothyroidism. About 10 to 12 years ago, I had hyperthyroidism and was in remission for a year or so. Ever since then, my thyroid levels have been normal. Is it possible that pregnancy triggered the hypothyroidism? I've been getting my thyroid labs checked regularly leading up to the IVF transfer, so I'm so shocked to see an elevated TSH now. Thanks in advance for any information you can provide. So the answer to this is yes. Pregnancy can cause thyroid issues. It is very, very common. Pregnancy affects every single cell in your body. Your body is growing another human being, and as a result, it's using up all sorts of resources everywhere. In addition, your hormones change dramatically, your circulation changes dramatically. I mean, I could go on and on. And so it can cause thyroid issues, even in somebody who's never had a thyroid issue before. And this often takes women by surprise. Now, okay, thyroid issue. Why do we need to take care of that? I would tell you as a healthcare provider, the thyroid is, in my opinion, one of the most important organs that you have in your entire body. In some ways, it's probably more important than your heart and your lungs. Now, you may be saying, why? Because when you have a thyroid condition, it affects your heart and lungs. So literally, your heart and lungs can work worse if you have a thyroid condition that's left untreated. Hypothyroidism, that's low thyroid. Some of the symptoms of that can be fatigue, constipation, dry skin, hair loss, dry eyes, gaining weight, feeling slow, feeling foggy. Hyperthyroidism, high thyroid, that can cause palpitations, increased heart rate, increased blood pressure, a condition with your eyes where your eyes start to go like this. It can cause headaches. It can cause diarrhea. It can cause insomnia. So as you can tell, and this is just the tip of the iceberg. Now, she mentions the TSH. So TSH is thyroid stimulating hormone. So you have the thyroid hormones, T3 and T4. Okay, they have a normal range. When those are too low, your thyroid stimulating hormone, TSH, goes high. So TSH is high when the hormone is low because TSH, thyroid stimulating hormone, stimulate the thyroid to make more hormone. Okay, so there's a balance, high and low. And if the hormone gets to be too high, the TSH goes really low because in an ideal world, they're balanced. They move like this, but they're balanced. This is why we know when there's an issue. Now, in her case, she's getting IVF. This means that for whatever reason, pregnancy you need a little bit of a help or a boost. So that doctor understands the importance of the thyroid and how it affects your circulatory system and other things and wants to treat it to proactively prevent an issue during your pregnancy. Okay, so I would absolutely make sure you're getting that checked. Now, if you do develop a thyroid condition, which is common, you will need to have your thyroid checked like very regularly. And it is very common for your thyroid medicine to be adjusted every single month. So imagine that. That's how important this is, that we might test your blood and check it and change it every single month. The other thing you guys should be aware of is that let's say you go through a pregnancy with no thyroid issue. Postpartum, you can also develop a thyroid issue. In fact, this is one of the things that I check for in psychiatry because it can also, both of those conditions can cause depression and anxiety. And so I need to make sure that your thyroid level is normal so I am not putting a Band-Aid over a different problem. Because if there's a thyroid condition there, a little bit of thyroid medication, you can feel like a completely different person and feel completely normal and really good. So it's very, very important that you guys get checked out for this stuff, okay? Any of you are joining us, remember you can ask any questions that you have in the chat. I have a question about yeast. I'm breastfeeding my 6-week-old baby boy. When I was 7 months pregnant, I had a very bad itching in my genitals, and I was getting a creamy white coating between the labia minora and the majora walls. The itching is gone without any treatment after 2 weeks, but the white creamy coating is still continuing. I don't have any pain or burning or itching, but I'm really worried about not getting normal white discharge. I took a suppository for 7 days. It was improving the last 2 days, but the course is finished. Is this a yeast infection? Please help. So this is a great question. So the answer is, of course, I'm not sure. However, it does definitely sound like a yeast infection. So what do? Unfortunately, you got to go to the doctor, because what would we do? We need to test that. We need to test that white coating and see what it is. It most likely is a yeast infection. Now, why is she starting to have resolution of symptoms? Because she used a medication to help treat it. What I love about this is that you took the entire course of treatment. So thank you very much. Ladies, if we're going to take a treatment, we need to do the entire thing and not do half of it, because that just causes you further issues if you don't just complete your treatment regimen. Now, what could be going on? You might have a more treatment-resistant yeast infection. They do exist. Unfortunately, we're overusing a lot of medications in the world now. And so a lot of our diseases are starting to become treatment-resistant. What you guys need to understand is yeast is a living organism. Bacteria are living organisms. Viruses are living organisms. These guys don't want to die. So over the years, they start to develop resistances to our standard treatments. So what might you do specifically for your yeast infection? I would definitely go to your healthcare provider. You may need to take an oral yeast medication like diflucan. Diflucan is extremely effective, and it can really help with yeast. And I am going to just look for you super quick, because you mentioned that you are breastfeeding. Diflucan, as I thought, but I never want to just say something without checking a resource. Diflucan, the oral pill used for yeast infections, is safe for breastfeeding. So this is a medication that you can take safely and still breastfeed your baby. So I would go ahead and I would call your healthcare provider to see what they want to do. They also might give you the medication without testing you. So they might be willing to just do it based off of your symptoms. So it's a really good option for you. We had a couple labor and delivery questions. The first one, my baby has dropped, feeling pain in the lower abdomen, but I'm 29 weeks pregnant. Is this normal? This is not normal. So pain in the lower abdomen, feeling like the baby's dropped into the pelvis, these are signs of labor. And if you're 29 weeks pregnant, you should not be experiencing these. Braxton Hicks can be kind of intense depending on the person. But Braxton Hicks are irregular. They come and go. You might have them for an hour and nothing more, but you don't usually have the baby feel like it drops into the pelvis. This is often a sign that you are dilating. So if you have signs of labor, and you can check out our labor video to see more of the signs, and you're before 39 weeks pregnant, you absolutely need to call your healthcare provider right away and let them know what's going on so that they can decide how they want to assess you. If you don't have a healthcare provider, you can't reach your healthcare provider, you need to go to a hospital to get checked out. Because at 29 weeks pregnant, that baby has the ability to survive outside of your belly. However, we want to make sure we're delivering that baby in a safe environment to reduce the risk of infection. And we can also give certain medications like steroids to help mature the baby's lungs so you have a successful delivery. The other one is, I had all of the characteristics of labor contractions and then they completely stopped. What do I do? So if you're 39 weeks pregnant and you had that happen, you can call your healthcare provider and ask if you can use some of the natural ways to induce labor. And we have that linked into the description right now. You might be able to use some of those methods to help kind of speed things up. Your doctor may also want to go ahead and bring you in for an induction, especially if you did dilate during the process, because it just may be that your body stalled out and needs a little touch of medication to get things going again. So this is definitely something that you can get checked out by your healthcare provider and see what they might want to do. We're going to be wrapping up here pretty soon. So if any of you guys have any questions, please put them into the chat for me. This one came to us on pelvic pain. I have pain while turning in bed. Can't even wear my pants. My gyno didn't listen to me. Please suggest any remedies. Okay, so pelvic pain can happen for a variety of reasons. So your pelvic bones, it's like the two hip bones, and then they come together in the front with a little soft membrane right here. So one of the things that can cause pelvic pain is when that soft membrane starts to separate, which can happen pretty early into the pregnancy, like second trimester, due to a hormone called relaxin. Relaxin's job is to like relax all the joints in your body, because for your pelvis needs to open up a little bit in order for a baby to come out when you're ready to deliver. So that relaxin hormone starts to work and it relaxes everything. This is also what causes women to waddle, that kind of duck walk, when you're further along. Now, additionally, you can have something called round ligament pain. So round ligament pain, so you have your big old uterus, right, full of a baby, and it gets bigger and bigger and bigger. The uterus is kind of like a ball, and it's attached inside your lower abdomen by these ligaments, which are kind of like strings that attach it to the abdomen. So as your baby gets bigger and this uterus gets heavier, those strings, well, your uterus goes lower, so they stretch. And that stretching, when you're moving, can cause a sharp stabbing pain. Unfortunately, it is very normal and common. However, and there's not much you can do about it. You just try to position yourself well. You might use a little bit of cold compresses or maybe a Tylenol if you're allowed to use it. You can't use warm compresses. That's not really good for pregnancy, especially for your abdomen. And you can't use other types of pain medication, including ibuprofen, Motrin, or Advil. You can't use any of those during pregnancy. What you said about not being able to wear pants, honestly, that's one of the homeopathic suggestions. Don't wear tight clothing. You want to try to take it easy. Listen to your body. You may actually benefit from getting some physical therapy. So you may want to ask if there's some physical therapy that you can do. And the other thing is you may want to look at pelvic floor therapy, depending on what's going on, because maybe you have some muscles that have gotten really tight and are almost cramping. The most important thing, though, is that you want to go ahead, and if you haven't talked to a healthcare provider and you're having this kind of pain, that you get it checked out, because you don't want it to turn out to be appendicitis or maybe constipation with a block or something else like that. Additionally, this person mentions that her gyno didn't listen to her. That is very concerning to me. I'm just going to say that. Your gynecologist is there to support you and to listen to you and help you. And you may want to get a second opinion if you are not being listened to, because there could be something else going on. One of the things that can cause pain, I don't think this is happening in your case unless you've already had the baby, because this would be a medical emergency, but a placental abruption can cause pain in the abdomen right before it happens. So you have a placenta. This is the organ that feeds the baby. This is your uterus, right? So it attaches to the wall of the uterus. And sometimes with an abruption, it comes off. Okay? That's a medical emergency. You can bleed to death. The baby can bleed to death. Okay? There is pain before that happens. Okay? So this is one example of something that could cause pelvic pain. Now, in this case, it would be severe continuous pain, and you most likely would have gone to a hospital to deal with it. But this is an example. Okay, you could also be in preterm labor. So you need to make sure you're being listened to. That's very, very important. I had a question on my antibiotic video that said, if medication is taken all 9 months of pregnancy, can it affect the baby's brain and physical development? So this is like a really complicated, loaded question. And I've been thinking really hard about how to answer this question, because it's kind of loaded. So what I'm going to tell you is, I don't think we know for sure. Okay? I really don't think we know for sure. And it's way complicated, because it would depend on the medication that you were given, why you were given it, how it would affect the baby. So I'm going to give you a really great example that I think highlights why this is complicated. HIV medications. So we now know that HIV medications can, if given during pregnancy for a mom who's HIV positive, will prevent HIV infection in the baby. This means baby can be born and despite sharing HIV positive blood with the mom, can be HIV negative and maintain HIV negative status for the rest of their life. This is a big deal. But these medications are very strong medications. They are our immune system medications. And as a result, there's probably some implications to a baby being exposed to this from the moment we figure out a mom is pregnant. But what are those implications? Who knows? There's a lot of medications that there's some evidence to say that they might cause ADHD, right? Well, in our same scenario of an HIV positive mom, is it better for a kid to have ADHD or better for a kid to have HIV? So that's one of the questions that's kind of hard to answer. So what I'm going to say in this one is, unfortunately, I can't tell you. I really can't, and I don't know that any doctor could answer this general question. What I would, if you have a specific medication that you are on, I would tell you that you need to have a conversation with your OBGYN or your midwife about what the medication is, what condition you are treating, and what the risks versus benefits are. I'm going to be finishing up here. I have one last thing. If any of you guys have any final questions, please put them into the chat. But I'm gonna just read out a comment that I got. So we have a video on fear of pregnancy, and it says, I have a mild case of fear of pregnancy and I'm childless. I'd like to try to overcome it in my case if I ever marry, and might consider kids in my remaining reproductive years. So fear of pregnancy is a very, very, very real condition. It is often overlooked. We often stigmatize women who say they're afraid to be pregnant. So many women will not tell anybody that they're afraid of pregnancy. And the thing is that there's a lot that changes in a body, and there's a lot of risks and complications of being pregnant that women need to worry about. So fear of pregnancy is a real thing. And yet many women who are afraid of pregnancy also want to be pregnant. They want to have children of their own. You can't just say, well, then adopt. It's not that easy. Adoption is a complicated process, and not everybody wants to adopt a baby. A lot of babies out there that are up for adoption also have a lot of pre-existing medical things to be considered. Then you might say, oh, well, then just have a surrogate, like have somebody else have the baby. Well, that's expensive. And again, people may not want to do that. So that's why fear of pregnancy is a really big issue we need to address. And women need to be supported when they say this. One of the things that you guys may not know, and it's something that's not talked about, is a woman might be afraid of pregnancy because she's the survivor of incest, rape, or other types of sexual violence. You know, if this is the case, allowing herself to be pregnant can put her in a very vulnerable situation. This can, unfortunately, she's going to have to consent to different checks that allow people access to parts of her body that were once violated. That's a very scary position to be in. It's very vulnerable. So for moms who are experiencing this, or moms to be, or women who are considering pregnancy, what you want to do is I would suggest that you start seeing a therapist, okay? This is not just as easy as giving you a pill either. This is something you're going to want to talk through and address why you are afraid. Is there some source to this? Again, using the sexual violence example, if you are a survivor of sexual violence, this may be a trauma trigger. And getting some specialized trauma therapy like EMDR may allow you to move through this fear. The other thing is, I encourage you to look up, there are support groups for this. And it's a really, really, really common issue. It's more common than you think. You are not alone. And for the rest of us, we need to treat these women with sensitivity. This is not a joke. This is not something that's just easily solved. So suggestions that you might think are helpful might actually just be harmful. Just be there to support your friend or your family member or your coworker if they express this fear to you. So with that, I'm going to finish up. My name is Dr. Samantha. I am the maternity mentor. You can find us here every Monday at 9 p.m. Eastern Standard Time. This is your chance to ask questions live. We had a couple of our viewers ask some questions live. as well as a chance for you to hear the answers to the questions that you have asked on our videos this week. Please remember, we have Facebook, Instagram, and Twitter for additional content. Share the channel and our social media with your friends and family. Please, please, please. Also, if you can like and subscribe to the channel, we really appreciate that. And it's awesome if you go ahead and you hit the notification button, because then you can be notified when our latest videos are coming out. And we actually have a great video coming out tomorrow. So sneak peek for those of you who are on the channel. Thank you so much, Z. Tomorrow's video is going to be about vaginal births after a C-section, or VBACs. So I really hope you guys check it out. We really appreciate you. Thank you so much for all of your support. My name is Dr. Samantha, the maternity mentor. Bye for now.